Hi guys, Becca here from Strong Woman Highs, and welcome to our bonus episode, PED Talks. Here's a little brief introduction before we get started. So I'm doing these bonus episodes around women's performance-enhancing drug use to increase conversations and awareness around PED use. And at the same time, I'm running a dissertation survey on the prevalence of PED use within the sport. PED use is a topic that gets discussed a lot, but actual relevant evidence is scarce, especially for women. So if you're a woman in this sport and you would like to take part in the survey, then check out the link in the show notes below. Quick disclaimer, this podcast is meant to inform and educate others on people's choices and experience around PED use. It is not advice to take PEDs. We do not condone the use of performance-enhancing drugs unless it is your informed decision to do so. This is not medical advice and is in no way related to our professional roles. I hope you enjoy this episode and remember to like, share and subscribe for future episodes. Enjoy!
Hello and welcome back to Strong Woman Highs - Life is a Mishmash. Today we have another special episode. This is PED Talk 7. So really going on now. We have Sammy Boothby joining the show, who has been on the show before, so I will link her episode for her Strong Woman Highs episode down below, so you can go and listen to that one first. But we have a very interesting take today on PED Talk, a little bit about harm reduction, probably a little bit of the other side of the coin, stuff that we haven't spoken about before. So, Sammy, welcome to the show again.
Hello.
No, thanks for being on, mate. So do you want to give a little bit of a background about why we've decided to get you on the show today and sort of what we're going to be talking about today?
Yeah. So obviously I'm a strong woman, do train regularly, compete regularly. But my day job is as a pharmacy technician. So I'm a regional lead pharmacy technician for a charity called Waythrough. And as part of that role, the organisation supports and runs a lot of substance misuse services across the country. So we have very large services in Sheffield, Leeds, Devon, Bolton, Cumbria. So as part of that, my role is supporting harm reduction, not just from kind of illicit substances, but also obviously something that's becoming a bigger thing now is the performance enhancing drug side of things and peptides.
Yeah.
So having listened to some of your other episodes, I messaged you, didn't I, and said, might be able to help at least signpost people. Ultimately, everyone has the right to make a decision as to what they do, whether they use PEDs or not.
Yeah.
From a job point of view, it wouldn't be something that I personally would do, just because I'm a registered healthcare professional and I'm not sure the GPHC would look massively fondly on if I was ordering things online.
Yep.
So there's sort of that kind of ethical consideration from my job point of view, but no judgment to anyone that does use, but I think it's just really important that they have correct information, they have support, and look at things to minimize risk, I think, ultimately.
Yeah. Absolutely. I love that. No, it's perfect. And I think it's another part that we haven't really spoke about. I know it's been brought up a couple of times on the PED Talks, and especially about you saying as well, obviously being a healthcare professional, it's the same for me. Whereas if I was to take PEDs and I started talking about it, I guarantee the HCPC would have a problem with that.
Yeah.
I know I'd be getting an email and definitely getting audited.
Yeah.
But yeah, it's one of them, isn't it? It's really interesting. And I do think there's a big missing area for harm reduction in PED use, and especially with the rise of peptides. So my co-author Andy had sent me a screenshot the other day of an Instagram story, and it was the Enhanced Games Thor's Stack, buy Thor's Stack here, and you could literally click on and buy what the drugs that he was taking, and you're like, this is he messaged me and was like, am I in an episode of Black Mirror? I was like,
crazy.
Feels like it.
Absolutely crazy. And I think that's the biggest thing as well, is that obviously if you're an athlete using PEDs, you're very much dialed in on your recovery, your nutrition, your training. So for someone to then go to a substance misuse service has sort of a bit of stigma attached to it, I think. And ultimately, I think by doing this, I'm hoping that it will just make people realize that actually substance misuse services are not necessarily for people that are using alcohol, heroin, or ketamine, that kind of thing. they also support people that are using things that are not prescription. Do you know what I mean? Which ultimately is what PEDs are. They are used for research. If you go online and order them, they are, they're not licensed medications. You're not getting from a doctor. So one of the services that we offer in certain areas are blood clinics. So that is probably my biggest thing. If people don't take anything else away from this podcast, would be that if you are thinking about starting on PEDs, please get baseline bloods.
Yeah.
Get a set of bloods to see where you are before you start adding extra things into your system, I think. So a lot of these blood clinics, I know particularly the one that we run in Sheffield, if you are a resident of Sheffield, you can attend these blood clinics. If you haven't started using PEDs yet, they will do a baseline bloods. They'll then get you to come back again sort of 6, 8, 12 weeks once you've started your cycle, do another set of bloods, and then once you finish that cycle, they will then do like a follow-up set of bloods. They will also then be able to kind of go through all those blood results. They'll be able to advise you on any other supplementation, things like if your cholesterol's looking a little bit high, cardiac risks, liver and kidney risks, and they'll be able to support you with that. And, I'd also advise you on not taking stupid doses. I think that's the thing. So a lot of people, they'll start PEDs, they'll start on a slightly smaller dose and they'll be like, oh, nothing's happening. But actually probably a lot is happening, but they don't realise because they haven't got those baseline bloods to understand where their levels were to start with. So that would be one of the big things. Obviously, if you can't get to one of the clinics, there's plenty of online blood people that will be able to do blood tests for all of these things as well. So it's just about kind of finding them. And I mean, if you're going to pay the money to use PEDs, you might as well pay the money for the blood tests as well. Ultimately, I think it should kind of be part and parcel of both, just to make sure that what you're doing is as safe as it can be, I think.
Yeah. 100%. I was just going to say so the clinic, like the one in Sheffield, is that a cost? How much is it, or is that a free clinic?
So if you're a resident in Sheffield, I think I would need to double check, but I'm pretty sure if you can prove that you're a resident in Sheffield, it's free.
Right. Okay. Yeah.
But there's also some blood clinics, and again, I can link I can send you the information, Becca, and we can share it.
Yeah.
That are heavily subsidised. So about £100 for a set of bloods. So again, not like super cheap, but again, if you're spending money on PEDs and peptides, then it's probably worth it for your long-term health, I think, would be to be from the blood clinics.
Yeah, 100%. And we've said it, but I think we said it on the last podcast with Rachel, maybe there's so many, like you just said there's so many online blood tests now, and they're not that dear. They really aren't that expensive. And it does seem like the most sensible way to do it, to just get that blood test first so that you know where you're starting from. And then it's objective markers all the time, isn't it? It's objective markers to work off of.
Yeah. In the same way that, if you're doing a cut or you're trying to bulk, you are getting all the kind of data that you can, you're weighing every day, you're looking at your sleep, you're looking at what food you're eating. I think it's just another kind of data point, isn't it, in order to make sure that you're able to perform at the best that you can.
Yeah, absolutely. And I think it almost links in as well to that, taking it seriously, like we spoke with Nab and Rachel on the last one, is you need to take it, if you're going to take PEDs, that's not the first port of call. Take it seriously. Is your sleep good? Is your nutrition good? Is everything else good? Then that's your next step if you want to take it that way. So yeah, it is. It's almost like you need to, don't do it unless you're going to take it dead serious, I feel like.
I think there's also been, I had this conversation with a colleague at work yesterday around, there's definitely been a switch around injecting. So obviously I've been a pharmacy tech now for 20 years. There wasn't quite so, the only people that would inject medication would be diabetics generally when I first started, or the other end were hard drug users that were using, heroin and stuff like that. Whereas now with the kind of rise of things like the GLP-1s, it's now become quite normal to see people injecting medication. So for like, especially for the younger generation, if you've got a mum that's using Ozempic, do you know what I mean? It's normal now to see somebody injecting. So I think that has also changed the kind of way people look at injecting. Whereas previously, I think with PEDs, it was like more for the kind of like hardcore bodybuilders, strength athletes. Do you know what I mean? It was, whereas now it's more, it's kind of almost been more normalized for the general public as well, who often are the sort of the ones that are not necessarily getting advice from the right people, I think. Do you know what I mean? They're getting a lot of their advice from TikTok or Instagram, which I think is, that's a whole other conversation, I think, isn't it, around kind of misinformation. And it's not just regarding PEDs. I've seen some absolutely shocking healthcare advice given on TikTok. And as a pharmacy technician, I'm like, ooh, nope. But, it's become so much more normalized, I think. So I think things like this are so positive to be able to get out the correct information around, how to do it safely. If you're going to do it, people are going to do it. It's a bit like using heroin and things like that. People are ultimately going to do it. But at the same time, if we can make it as safe as we can, so things like naloxone, for example, has become massive within the opiate kind of world in the sense, and the number of lives that saved has been huge. So I think, we need to look at that sort of similarly in the kind of PEDs era that we're kind of seeing now, I think.
Yeah, 100%. I totally agree with you. I do think the rise of injections is just before that was a really like, oh my God, no, it's like only the serious bodybuilders would be injecting things.
Yeah.
Nowadays, like everyone's banging an injection into them. No one cares at all. People do it at home. And like, that was one thing that came up on the survey was like, obviously I will get into needle like exchange and how to get rid of them in a second. But I think if we go through like using needles and using like, the safest way to do that first of all, because obviously in the survey it came up that like they're just so cheap to buy. They're pence on Amazon, absolute pence. So people can just buy them on Amazon and just be like, oh yeah, cool, I'll just do this. And you're like, there's so many risks that come with injecting yourself at home. It's crazy, isn't it? So you'll know better than me. Do you want to tell us some of the risks of injecting at home?
This is still quite a new topic for me in the sense that obviously I've been aware of it, but it's still kind of more of a specialist subject, I suppose. But so basically you run the risk. There's lots of risks of injecting. Obviously, the ones that people are most like aware of would be things like bloodborne viruses. So if you're sharing needles, but it's not just a case of sharing needles. It could be if you're sharing a vial. So like a lot of people, they'll buy something online and, 2 or 3 people will share. So it's things like making sure that if you're putting a needle into the top of a vial, that you use an alcohol wipe. I mean, it's not perfect, but it's going to reduce kind of infection risk. That you're only putting fresh needles into the top of the vial. You're not using needles that have already been into a person. Using things like peptide calculators, which will give you a more accurate dose with regards to reconstituting the powder. And also things like, so some PEDs are really oily, like really, really thick. So it's things like injecting it really slowly. Don't inject into the same place all the time because you end up with like these lumps. Build like scar tissue and stuff that builds up. Making sure that it's in a particularly like, more fleshy area makes it less painful, those kinds of things. So a lot of it's common sense. And with regards to needles, again, there are ways of getting rid of them. I would not advise putting them into the rubbish bin. That would be, so most substance misuse services offer needle and syringe exchange programs. So that is where you can go in and they will give you a pack that will include alcohol wipes, needles, syringes, depending on what you're injecting, things like citric acid, that kind of thing. but they will also dispose of old needles.
Yeah.
So that is also something that a lot of pharmacies do. So if you go to a pharmacy, they should have a sticker in the window that says that they do needle syringe. They offer the needle and syringe service. But if they don't, you can always ask them. They might say no. There's also, you can find it online, that information as well. The other thing, occasionally, sometimes councils will come and collect sharps bins, but they can be a bit funny if it's not something that's prescribed as such.
Yeah.
So often they'll collect things if you're on insulin, that kind of thing, but it's always worth an ask. I think a lot of places would rather they were disposed of correctly. But yeah, any drug and alcohol service, you can literally just walk in. You don't have to be a patient. But yeah, always pop them in a sharps bin, keep them out of reach of children. And the same with the PEDs. Like, it's really important, if you've got kids in the house, got animals in the house, make sure they're kept in a cupboard that's like out of reach. If you can lock it, even better. You can get little metal tins that are lockable, something like that, to put them in so that they're out of the way and that people aren't going to access them accidentally. But yeah, needle and syringe services are everywhere. And again, I can send over some information so we can share that information around those as well. But don't feel that just because you're it's PEDs that you're using, like, there'll be no judgment. Nobody that's the whole purpose of these services, is to try and reduce that stigma, to try and encourage people to use things safely.
Yeah. I think it's difficult, isn't it? Because straight away you get a stigma with the fact that it's just called a substance misuse service. Like, you're like, I don't want to call it misuse. Like, the misuse is the bad word, isn't it?
I've had this conversation. I've had this conversation with colleagues as well, and we're like, but we can't really call it anything else.
No, what else would you call it? Yeah.
But I completely agree. If you're not if you're a strength athlete that is eating and sleeping and training hard, like, why would you go to a substance misuse service? But ultimately, like, they're there to support anybody. It doesn't matter what substance you're using. It could be food, it could be alcohol, it could be smoking. That is the purpose of the service ultimately. But it's difficult with a name.
It'll be interesting to see as well if, like, the sort of substance misuse services and programs do see an increase in, obviously, like, PED use and peptide use over the next few years, because it seems to us like there's obviously a lot going on at the moment, especially with, like, the enhanced games, and because it's so in general population media as well, like, surely that is going to trickle in at some point, or is trickling in now maybe. But it'll be interesting to see.
I think we have already started seeing an increase. I don't think that, so my background as a pharmacy tech was in community pharmacy. That was, I've worked for Boots and various other community pharmacies, and the needle and syringe exchange started about 20 years ago. It was something that came in. It was one of the, things that started just after I qualified. And you definitely see, like, I worked in a community pharmacy near a particularly large army base. Interestingly, we saw a lot of needle and syringe exchanges from people that were clearly military. And that wasn't from illicit, like, that wasn't from heroin or anything like that. That was 100% PED use. Because if they get caught using anything else, they get kicked out. It was interesting, but we've definitely seen an increase. We've seen an increase in starting a lot younger. So my colleague had a conversation with 2 16-year-olds the other day that were using growth hormones.
Oh no!
So, I mean, they're getting a lot younger, whereas previously I think it was sort of like, men in their late 30s, 40s. We're now seeing a lot more teenage boys, I think, and some girls. I think from a peptide point of view, I think we're seeing more kind of, like the tanning injections, that kind of thing. GLP-1s being bought. you know, off these websites as well for young girls, I think is a bit of a concern as well. And to be fair, a lot of, you know, it's one of the most contaminated markets. The stuff that
Yeah.
you're buying online isn't
How do you know?
necessarily pure.
Yeah, exactly. That's what's terrifying, isn't it? And as well, like, I know we've obviously spoken a lot about injecting, but going on to like sort of the easier ways to do it. Obviously, you've still got your orals and like the rise of nasal sprays and stuff like that. Like I see that all
Yeah.
the time, and people almost are just like, oh well, it's only a tablet, it's only a nasal spray. Like that's such an easy access for kids to be like,
Yeah.
oh, I'll just get that. That's not bad if I don't have to inject myself. Like,
No, and again, this is down to this is why we sort of like we're all, as a harmonization thing, we're always saying about bloods, is that actually oral is far more impactful on your liver and kidneys
yeah,
than injecting. So there are some pros and cons to both, I suppose. Mainly it's because of the coating that they put on the tablets, because obviously if they don't coat the tablets, they just go straight through you and you just don't, it's not absorbed where it's needed to be absorbed.
yeah,
There are services that you can get your stuff tested for potency. So like there are certain like groups. I mean, there's one in Cardiff called Wedinos, which I've used in a previous job when we've had I worked in a psychiatric hospital, and you know, we've searched a bedroom and we found something that we're not sure about. You can send it to them and they'll kind of give you a rough idea of what it is. So there are services available that you can send stuff to, and they'll say to you, yeah, it's 85%, you know, fine.
yeah.
But yeah, it's just about making sensible decisions ultimately, and also, you know, don't go bonkers with the dosing. You probably need a lot less than you think you do, I think, from it. There's some really good reference sites like Peptide, which basically lists, I think it's got over 365 different peptides, as well as like peer-reviewed citations on it. So there's a bit more kind of some evidence based, you know, if you want. But equally, you know, it'll link you to kind of published research on the peptides as well, which is quite useful. But things, again, like when you're looking at dosing, things like peptide calculators will give you exactly how much water you need to mix it with. And also things like, you know, making sure that you don't use tap water. Do you know what I mean? Like, use proper, you know, water for injections, those kinds of, something that's sterile.
Yeah.
Mix it with would be my thing. Like, tap water is not the one.
No,
When it comes
absolutely
to
not.
reconstituting things. But also there are resources online with regards to how to inject safely as well. Like, there are some, you know, it sounds really, people get information off YouTube, don't they? So
loads of people get
you know,
information off YouTube.
I mean, my husband does when he's trying to figure out how to do a DIY job. He'll Google, you know, YouTube, how to self. Do you know what I mean? And actually, some of the YouTube videos are quite helpful, but it's just making sure that you pick one that is kind of, that's, you know, that's done more by a professional than
I'm the
person sat in their bedroom. Do you know what I mean?
They look like they could be a doctor, follow that one.
Basically, yeah. If it looks like they
you just use a bit of critical thinking there. If they're sat in the bedroom as a like teenage boy, probably don't follow that one.
No, he's probably not washed his socks or no, that's not the one.
I do think it's really interesting. I know as well, I've heard this a couple of times, and I'm like, this isn't advice. We're not giving advice here. We're just trying to give like information. But when obviously a lot of people store peptides in the fridge, waiting until that hits room temperature before injecting it, because otherwise that's like, from what I've heard, I'm not saying I've taken anything here before everyone starts, but it's very painful. So like, little things like that like maybe you wouldn't be aware of when you first made that decision.
Things like if it's particularly oily based, you can warm it in your hands, but don't take it out the fridge and stick it right in, because it will hurt. And it'll take a long time, like the pressure. Yeah, I think people underestimate how difficult it is when something is really viscous. If you've got more water based, then it's a lot quicker and a lot easier. But a lot of these sort of, it's particularly things like testosterone based PEDs are their base is oil.
Yeah.
So yeah, warming up in your hands, making sure you use an alcohol wipe in the area that you're gonna inject it, that kind of thing. But yeah,
Interestingly, as a physio as well, so I know you mentioned about continuously injecting into the same area. I've seen people with this where they have like lumpy areas of their body where they've injected so frequently, it feels like there's like scar tissue, like buildup of scar tissue under the skin. And it's crazy. It's a really weird, like I've seen it before and been like, oh my God, you've got loads of muscle knots. And I'm like, hang on a minute. Let me just ask you a question here.
Yeah. So again, my background is I'm a mental health specialist pharmacy tech. So previous jobs we used a lot of antipsychotic depots. And they're very similar in like they're very viscous, and you can often tell when a person's been on a depot for a while because you kind of run out of space.
Yeah.
Because they become so then they're so uncomfortable. But obviously, you know, from a treatment point of view, they can be life-changing for these patients. So sometimes it's that kind of benefit risk.
Yeah.
But yeah, definitely, you know, making sure you change sites.
Yeah.
Don't inject in the same place is quite important.
What I also think would be interesting as well is like risk factors for obviously infection. So what should people be looking out for if you say, because I know is there something about also injecting air that can be really dangerous? So injecting air, and then also what to look out for if you get infections in the site that you're injecting.
Yeah, so I think the risk for air embolus is higher if you're injecting straight into a vein.
Yeah.
So most PEDs are kind of subcut or IM, so they're into the muscle or under the skin. I think it's basic common sense. I think if you know, is it hot? Is it red? Are you feeling a bit rubbish? You know, is it oozing?
Yeah.
You know, just be sensible. And also the biggest thing as well is as a pharmacy technician, the number of times I've had conversations with patients and you ask them, are you taking anything else? So like they come into hospital, you're doing a meds rec, or you're looking at their prescribed meds, and you come to their bedside and they're like, you know, are you taking anything else? No, I'm not taking anything. Right, okay, so do you buy anything from the shop? Do you buy anything online? Oh yeah. And then suddenly they reel off. It's if you speak to a healthcare professional, be honest with them.
Yeah.
They won't judge you. But in order for us to be able to treat you effectively and make sure that we're not going to prescribe you something or give you something that's going to interact with what you're already taking, we need to know about it.
Yeah.
So I think that would be my biggest thing as well, is that be aware of prescription meds as well. So if you're taking, you know, if your GP's prescribed you something, just be cautious. Because obviously there isn't a lot of research around drug interactions with drugs that are non-prescribed.
Yeah.
So things like PEDs and peptides, there's very limited information with regards to how they interact with things like antidepressants or, you know, blood pressure medication, those kinds of things. So it's always worth, if you want to take PEDs, that's fine, but it's probably worth having a conversation with somebody that knows meds around if you're taking anything that's prescribed. So whether that's your GP or a pharmacist, you know, they won't judge you, but it's trying to keep people safe as well, you know. But yeah, and just being honest. If you do end up with an infection, or you do, you know, don't go to A&E and say, oh, you know, I don't know,
stung by a bee.
Yeah, exactly. Do you know what I mean? The treatment for a bee sting is very different to a treatment for an injection site infection.
And there's a level of GDPR. Like they can't say anything. Like unless it's putting someone at massive risk. Like they can't tell anybody that. So like you're putting yourself in danger by not telling them. Like it's
definitely.
really crazy not to say it. So yeah, I'm big on that. Like the minute you go into hospital, just tell them. Like
honestly, it won't even have been the craziest thing they've seen that day, let alone that week.
No.
Do you know what I mean? Like some of the stuff. Yeah, I'm now at that point in my career where I'm like, nothing really surprises me.
Nothing phases you.
I'm like, okay. So-and-so's done something silly. Oh well, right. Okay, let's treat them and move on.
Absolutely fair, yeah.
Yeah.
I think as well, another interesting point to talk about is obviously the addiction risk with it. And that's something that we haven't really spoke about with obviously PED use. And I think it's just not really spoken about, because I think when people do take PEDs, it's for health reasons, like, and wanting to perform better. And but does that then borderline into an addiction of like, of being able to perform better, of being stronger? Like it's the sort of same vein.
I suppose it would be different to say heroin addiction, in the sense that actually changes your brain chemistry, and there's like a whole thing around, you know, your body needing the drug.
Yeah.
But I do think, you know, having spoken to people that have taken, you know, I've got a friend who's a bodybuilder, and he was taking for quite a few years, and he's been really open around, he stopped taking so that him and his partner could have a baby, and he's been really open around the fact that he felt awful. Like he didn't feel like himself anymore when he came off it. It's probably taken him a good 6 months to figure out what he wants to do, because he doesn't want to go back to bodybuilding, because he will never look how he looked when he was on gear.
Yeah.
So he's had to find something else to kind of push himself into and do something that's equally as hard. So yeah, I think there is that kind of risk around, oh, I look amazing, or if I look good, so therefore I'm going to use a bit more. And I think you could easily get into that cycle of that kind of vicious cycle of, I need to keep taking a bit more, I need to keep, which I think is why it's really useful to, you know, one, talk to somebody that potentially isn't taking, you do know what I mean, that isn't using, that can maybe give you kind of a bit more of a sort of, don't be a dickhead, do you know what I mean? Tone it down a little bit, or talking to somebody that's a professional that kind of knows about these things, because obviously there are massive risks to taking more and more of these drugs. You know, the research hasn't really been done yet, but we all know, like, you've only got to look at some of the kind of coroner's inquests and stuff around young people that have just dropped dead.
Yeah.
You know, there is a very clear link, although it's not been researched or proven, but there is a very real cardiac risk
massive
around the use of massive stacks. You know, so that's something that people need to consider. And again, that's why we kind of say baseline bloods, because actually that will pick up if there's anything. I mean, if you can get an ECG before you start PEDs, even better. You know what I mean? Like, you know, just so that you know that your heart is all right, you know, when you start. I think that's ultimately all you can do, is just sort of know what it was before, keep an eye on it while you're using, and then, you know, once you've stopped, kind of also looking to see that it's kind of gone back to where it was when you started. It probably will never go back completely to where you were before. But yeah, it's just about minimizing risk and being sensible about it. And it's just education. And I think with the increase kind of social media and that kind of thing, I think there will be, I'm hoping that education will start to become more prevalent, I think, and people can make more sensible decisions about it.
Yeah, absolutely. Yeah, I totally agree. And I think it's that informed, like, risk assessment almost, isn't it? Where as long as you're informed and you know you've made that decision, but you do need to be aware, like, there is real severe risks, like
Yeah.
parod wire, like that sort of thing. It was a crazy, like, he was so
Yeah.
young and literally
Yeah.
had just gone into bodybuilding, was posting about his stacks. It's mental that no one really spoke out about that afterwards and was like, hang on, maybe this isn't
Yeah.
the safest of ideas. You'd have thought that might have pulled a few people back, but it doesn't seem to have. I think with the enhanced games coming along and like pushing it massively, that's
Yeah.
just like skyrocketed it. And it's almost like that, like men when they get to the 30s and 40s and they're like, oh, you're feeling a bit fatigued, a bit not great, all this. Well, it's low dose test. Like, here we go, have some testosterone, you'll feel
Yeah.
so much better. There's no mention about what that could be doing to their insides of the bodies at
No.
all. And that's the concerning part of it, that like people are just getting dragged along with this. Oh, well, online it said this, so I was just going to take that and it should be fine. Like, I'll be all right.
Yeah.
What's your heart attack risk now though? Like,
Yeah.
do you know
And
that?
also I think as well, like, you know, we don't screen for cardiac issues unless there is a family history or
Mm,
you get cardiac issues. Do you know
yeah.
what I mean? As a country, it's not something that's standard. It's not something that we do as standard. Um, and there's a lot of people walking around with higher cardiac risks than they think. I
Yeah.
think, you know, especially in the kind of gym world, you know, we're fit,
Yeah.
we train 5 days a week and we do this and we do that, and you know, I can run 5K in 25 minutes. Do you know what I mean? Like, but actually cardiac issues can hit anybody.
Yeah.
You know, you can have a genetic predisposition to it. You can have, you know, dodgy cholesterol, not realize about it, especially, you know, if you're, you know, most of us that are fit and well and train, you know, I couldn't tell you the last time I went to the doctors.
No.
I couldn't actually tell you the last time I had a blood test. Do you know what I
No.
mean? Like, whereas if you're somebody that's got some sort of chronic health condition, chances are you had blood tests about 6 weeks ago. Do you know what I
Yeah.
mean?
Yeah.
Like,
Yeah.
you know, my stepdad's not very well. He's had more blood tests in the last 3 months than I think I've had in the last 3 years. So none of us really know what our baseline is. We
Mm-hmm.
only know what our bloods look like when we get poorly.
Yeah. Yeah. Yeah.
um,
Yeah.
so yeah, I think it's that's probably it. Again, like I said at the beginning, if people don't take anything else away from this, it's about making sure you know what your normal is
Yeah.
before you start adding to it, I think.
Yeah.
Um,
100%.
and equally, you know, like PEDs, they, you know, they enhance, but they also don't do the hard work. Do you know what I
Yeah.
mean? Like, you can't just slam a load of gear and expect to still be the strongest in the gym. You've still got to do all the training, and you've still got to eat properly, and you've still got to sleep well.
Yeah.
So I think sometimes people are like you were saying about being more dialed in when they're injecting something. I think that's they then associate that with the PED use, and actually it's probably not the PEDs. It's probably just the fact that you've dialed in your nutrition, you're sleeping for 9 hours a day, and you know, you're eating better because you
Yeah.
don't want to waste the opportunity.
Yeah.
Um,
Absolutely.
so actually, it's then my argument would be, well, if you'd just done the sleep, the eating, and the training, like, would you have
Yeah.
probably got similar results? Like, there's no way of knowing, is there? Like,
Yeah, absolutely. And I think this is a massively missed part. It seems like an easy fix, I think, for a lot of
yeah,
people, PEDs is just an easy fix of, yeah, well, I'll do that and then I'll get to where I want to be. And yeah, you probably will get there faster, like 100% you will get there
yeah,
faster. But like you said, like if you just dialed in on everything else,
yeah,
you'd probably get to where you wanted anyway
yeah,
without the increased risk as well. So it's worth just taking some time with that
yeah.
decision. Like I've done it I've been deciding for years and I'm still not decided.
And this
But
is it, and it's about making that decision based on you're like how you feel about it, not how your coach. I mean, I
yeah,
would run a mile if my coach turned around to me and had that conversation with me and said, "Oh, I think you should try X, Y, and Z." I'd be like, "No, no, no. See you later. I'm going to go get another coach," because that's not their job. Their job is to support you to make informed decisions. You shouldn't be being
100%.
pressurized by a coach to start using something.
100%. I totally agree. And I feel like anyone who recommends that. So I've had it recently where one of my clients has come to me and said, oh, I think I've got this. What do you think about taking this? And I've said, Absolutely not. Like, you need to go to the GP, you need to get a blood test.
Yeah.
Let's start from that position. Like
Yeah,
that,
yeah.
like, it's just not even going to enter my mind that this is an option right now, because that's just like so far away
Yeah.
from where we are right now. Like, it's crazy. And I
Yeah.
do, the coach thing really, that's the biggest thing that concerns me. I hate if there's anyone, if you see a coach online and they're posting that they're a peptide specialist or hormone replacement therapy specialist or anything like that, one, ask them the credentials, because guarantee they won't have them, because
Yeah.
it's not a
No.
thing. And don't just listen to someone saying it. Like, it's so,
Yeah.
do your own research. Don't just go on what someone else has said, because
Yeah,
chances
definitely.
are they actually don't know very much either.
And as a woman as well, I think it's really important. I think it's probably more important for women
Yeah.
with regards to PEDs, in the sense of, like, especially when you get to, I'm 38 this year, very much heading towards, requiring some support hormonally, and that's something that happens to all of us. But I would definitely be going down the GP route for that as a woman, rather than trying to self-medicate.
Yeah,
It's
absolutely.
challenging. You have to advocate for yourself a lot of the time when it comes to kind of HRT and things like that, because there are still very much that kind of thinking. Not all medics, not all healthcare professionals think the same, but there's still that very much like, oh, increase your breast cancer risk and all that kind
Yeah,
of
yeah.
stuff. But actually, I think as well, it also shows that disparity between female healthcare and male healthcare, in the sense that, if my husband went to the doctors, had a blood test, and his testosterone was low, they'd whack him on some tests. Do you know what I mean?
Straight away.
Without even thinking about it, without even having a conversation around the risks and benefits.
Nah.
They just
Straight
give
up.
it to him. Whereas
Yeah.
as a woman, if you go to the doctor and you say, I think I'm perimenopausal, I think I need some help. Oh, well, have you tried this? Have you tried that? And it's like, my body stops producing the hormones that you've told, like, that it requires for its
Yeah.
entire life. But you're not going to give me them
Give me
to
them
make me
back.
feel like a normal human being again. However, if I came to you with high blood pressure, you'd give me a blood pressure medication.
Instantly, without
Instantly.
a second
You know what I
thought.
mean? Like, and I think I think as a woman, that's quite frustrating.
Yeah,
Although
absolutely.
there are a lot more GPs and stuff who specialise in women's health, and you can
Yeah.
also go privately. I've had friends that have gone to private menopause specialists and have not had to fight for the treatment that they need. But yeah, that would be, as a woman, don't mess around with that kind of hormone health. I think you need to speak to GP, see what they suggest, try the kind of prescribed route.
Yeah,
um,
absolutely.
that would be my thing. I wouldn't be messing around with, like, female hormones. I think, we're complicated creatures.
Yeah.
Really complicated. And we're all so different as well. I think
Yeah.
that the other thing is that, it's very much a case of, like, what works for one person. For example, if you were to go and buy Thor's stack
Yeah.
and use it,
I'm not going to pull 515 kilos, am I?
you'd probably be on
Let's be real.
You'd probably be on your ass. Do you know what I mean? Like, it would probably knock you on your ass. But it's just mad. Like,
Yeah.
what works for a man that is 6'7" or whatever he is, and 100 and nearly 200 kilos is not going to work for an under 82s female athlete.
Yeah,
Do you know what I mean? I
100%.
think that's what people have to remember as well, is that, well, it's with all medication, it's not a case of one size fits all.
Yeah.
The antidepressant that works for me is not going to work for you. Do you know what I mean? And I think it's a
Yeah.
very much, and I think that's something that people need to remember.
Yeah, 100%. And it's
know.
so easy to do your own research nowadays as well. Like, I know obviously we rinse AI all of the time and it's not my favorite thing in the world, but if you can use AI well and you can ask it for evidence-based, like, information, evidence-based research, it will give you the information that you need to make those informed
And not
decisions yourself.
Wikipedia.
No, don't listen. Anyone can write anything on Wikipedia.
Wikipedia is not the resource to get healthcare advice.
No,
at all.
absolutely not. Absolutely not. Well, we'll make sure we have all the research or the resources that we've been discussing in the show notes below. I'll try and add as much as possible into the show notes below, so that if people have any, like, questions or any stuff like that, they can obviously have a look down there and see if there's anything there. Obviously, are people able to contact you? Like, where would be best to contact you if they wanted to ask questions, that sort of stuff?
Yeah, I mean, obviously, I'm on Instagram, so yeah, happy for them to DM me, or if they reach out to you, I'm happy to share an email address with
Yeah.
you, Becca, and then we can pass it on. But yeah, just send me a message. I'm more than happy. And like I say, if I don't know the answer, I know people that will know the answer.
Yeah.
And I think that's the thing as well. It's when you go to a healthcare professional, if they profess that they know everything, I'd probably be going.
Be
That's one thing I've
skeptical.
always said. I've got 20 years of experience as a pharmacy technician. I still don't know everything. There's
Yeah.
still stuff that I don't know the answer to, and I think it's really important to be kind of open and honest about that and say, look, I don't know the answer, but I can find the information for you. And like you say, using reputable sources
Yeah.
um, is always super important as well.
Absolutely, yeah. So if anyone's listening, they do have any questions, obviously feel free to reach out to me or Sammy. And yeah, we'll try and answer your questions as best as we can. And yeah, have a look at the resources below and send us any questions. Have you got any final words for the podcast, Sammy? This has been a class episode. I've really enjoyed this. Very interesting.
Hopefully it'll help somebody. I think what you're doing is really, really good. And I think it's so important just to get kind of good information out. And then what people choose to do with that information is up to them. We're not advocating
Yeah.
either way. We're just kind of wanting people to know the information that they need in order to make an informed decision. And ultimately that's all we can do, isn't it?
Yeah, 100%. No, I love it. Well, thank you so much for being on, Sammy. It has been a pleasure again. It's been class. But yeah, I hope you guys all enjoyed listening. And again, any questions, just send them our way and we'll try our best to answer them. So yeah, we'll see you all on the next one. Goodbye. Thanks for listening to this episode of Strong Woman Highs, and I hope you enjoyed it. If you want to support the podcast, then please give us a follow on Instagram. Or if you would like, we're also on buymeacoffee.com/strongwomanhighs. This is where you can send us tips, or you can also join our membership area, which is $5 a month or £4 a month. It's the silly Gosling level. We'll post out any extra content that we get on there, and hopefully a few little free giveaways of things as well. The podcast currently doesn't cost a lot to run, which is what we're trying to keep it as, but we would like to be able to cover our costs, and also once those costs are covered, any profit that is made on Strong Woman Highs will be getting saved up and put into a pot for future Strong Woman competitions that we can sponsor. So if you have a Strong Woman competition that you'd like to be sponsored, or if you want to be on the podcast, then give us a shout, send me a message on Instagram or on YouTube, anywhere else you can get us, and we'll get it sorted, because the more women that we can get on, the better. Thanks for listening and watching. Bye!